Hello everyone, Namaste. In my last video, I had given you all the information about who has to do the Pap smear, when you have to do, and who don't have to do the Pap smear. All those information. And today I'm going to tell you how to do a Pap smear test and what if it is abnormal. So when you go to your doctor, they will put you on a table in a dorsal position, and they will separate your legs, and gently we will introduce a speculum to separate the vaginal walls, and then we expose the cervix. When we get a good view of the cervix, we take a cyto brush and we will scrape, we will gently brush it on the opening of the cervix, and we take the cells and we send it for the test. So very simple test, and it is not at all painful, and it's not going to cause any discomfort or anything. But after the test, some of the people may experience a few drops of blood or little bit of bleeding, which is expected and it is normal, and there is no need to get scared about it. And the thing you should know, the next the question is, should we do the Pap smear test during pregnancy? Usually we don't recommend to do this test in pregnancy, especially if you have done all your routine tests before pregnancy, and if it is normal, we don't recommend doing this test during pregnancy until and unless it is really required. Like when we examine the cervix, if it is very doubtful, very abnormal looking cervix, only then we will advise to take a Pap smear. Otherwise it is not recommended. Also in pregnancy, there is a lot of hormonal changes in the body, so that make, especially after 20 weeks of gestation, it becomes very difficult to interpret these cells. So it is usually not recommended in pregnancy, and after delivery it can be done if required. Now, so you have done your Pap smear, and the result, it will take 1 to 2 weeks for the result to come. And what if the test is abnormal? The test is normal, you will continue with your routine screening test. What if it is abnormal? So if it is when it is abnormal, it can be a very mild abnormality, or it can be something severe. If it is a mild abnormality, like we call it as ASCUS, that is atypical squamous cells of unknown significance. If it is something like that, and if the HPV test is negative, and if it is very mild like this, we will advise you to repeat your Pap smear in 6 months or 1 year. So I mean the frequency of the Pap smear increases, and we will repeat the test, and we will see whether the changes have regressed, and if it has become normal or it has progressed. So if it becomes normal, then we will advise a routine regular test, which I mentioned in the last video. If it is abnormal, or if it is progressing, or if from the beginning, if the Pap smear result is more abnormal, we will recommend to do a colposcopy. So what is colposcopy? The colposcopy, we will examine the cervix with a camera, and then if you find any doubtful or abnormal areas, we are going to take a small tissue biopsy. We will take it for the test, and we will send it for the test, and it is examined under the microscope. So with this biopsy, it tells us whether there is cancer or not. I mean, it confirms, it's a confirmative test. So if it is normal, then you can do your regular test. So based on the Pap smear result, how severe, how bad it is, based on that, your doctor or your gynecologist will advise you what to do next. So I've given you so much of information about the Pap smear test, how simple the test it is, how much useful it is. So what is your next step? What you have to do? It's not a big hard work or something. What we are asking you to do is just take 1 day from your 5 years of life and just use it to make a Pap smear test. Go to your nearby hospitals and screen yourself and help yourself, and make for the betterment. You work for the betterment of your health. So take care. If you like all these videos, if it is more informative for you, please like, share and subscribe, and also wait for my next videos. Thank you. Namaste.